One sector doing pretty well at present is private health insurance, notwithstanding the government's new means testing for the private healthcare rebate. And with increasing travel by workers and students, health insurance is going global. Today, NIB announced a tie-up with the largest American private health insurer, United Healthcare, whereby the American giant's international customers will have access to NIB's hospital network, doctors and other services. For a closer diagnosis, I caught up with NIB's CEO, Mark Fitzgibbon. Mark Fitzgibbon, welcome to the programme.
My pleasure.
Now, what is behind this new strategic alliance with America's largest health insurer?
Well, this is all part of an emerging global story. One of the consequences of globalisation has been this rapidly accelerating mobilisation of workforces. We're seeing it in Australia with the heavy demand for migrant workers. And what's happening for companies, big companies in particular like United, who have a large corporate clientele, but it's also true of NIB for that matter, is that their clients are coming to them and saying, look, it's not sufficient anymore for you to simply cover our workers while they're here in America. We need a level of health care cover which protects our people wherever they are in the world, whether in Japan or China or Australia for that matter.
So what is in it for NIB? Can you quantify the upside there for you?
Well, the detail of the commercial arrangements are, as you'd expect, confidential, but essentially we get paid. We share in the underwriting risk of the insured while they're here, and we also get a fee for the service we provide.
But are you expecting many thousands more new members?
Well, we've been asked that a lot. Again, there are details which are commercial in confidence, but this partnership is more about the potential, the opportunity, than it is the here and now. It really depends on how successful United are in growing their global cover business and to what extent we benefit from that effort. We already insure a lot of inbound migrant workers, in excess of 20,000. We mainly do that by selling products online. This is just another pipeline for us, another sales pipeline. And how big it can potentially grow, well, time will tell. But it's also providing us with a greater platform to start looking at ourselves providing global cover for Australian companies. There are about 90,000 Australians each year who leave the country to live and work overseas on what are known as long-stay arrangements. And
Now, just on that, you're not actually getting any quid pro quo from United Health, are you? I mean, your members don't have access to United Health in the US, do they?
Not yet, but that's a logical step in the evolution of this relationship and our own global ambitions, if that doesn't sound too serious.
But can I ask you more generally about, because you obviously have a window on US health at the moment, can I ask you about Obamacare? A lot of these reforms aren't going to come in until 2014, as I understand it, but what is it likely to do you think, to the health of insurance companies in the United States?
Oh, I think it's generally positive for the health insurance sector there, if only for the reason that they're going to pick up another 50 million people who are currently uninsured. There are some more onerous requirements being imposed upon them as a result of Obamacare, such as the government specifying a maximum profitability that they can make. But, my sense of what's happening there is that, the insurers like the individual mandate in particular.
In the meantime, what do you reckon that the government's mean testing of the private health insurance rebates, what will that be doing to NIB customer numbers, do you think?
Well, we always held the view that while the change was unhelpful to our business, it was always going to have a modest impact. We've seen nothing to date to suggest that it's having anything but a modest impact. Health insurance is more affected by things like interest rates, unemployment, the factors which influence people's incomes rather than prices per se. And of course, the degree of public confidence in the public system, which you'd have to think is, at an all-time low.
So to what extent did your early offer, as did many of the health insurers, your early offer to your members to pay for next year, did that keep a lot of loyalty, do you think?
Well, it certainly has that effect because people, by definition, lock themselves in for 12 months. But we were all surprised with the flood of prepayments.
Finally, you've had quite a jump in your share price since this time last year. I think it was about $1.15. It's now up over $1.50. What do you put that down to?
Oh, it's purely earnings growth. Since we listed the business almost 5 years ago, we've increased underlying earnings on average by about 27% each year. Last year, based on our the year just gone, based on our guidance, is going to be a little bit tougher because it's a much more competitive environment. But I think we've demonstrated that health insurance is a real commercial market, and that well managed and well promoted as a product, you can get the type of return on invested capital that we aspired to at the beginning, and which we've delivered.
It's a market that looks fairly robust at the moment. Mark Fitzgibbon, thank you so much for joining us.
My pleasure. Thanks, Tiggy.